Good morning, everyone. Janelle Tennyson here with the Joint Replacement Academy. I had a couple interesting questions about the shirt I was wearing a couple days ago when I recorded my morning coffee conversation. It was a gray t-shirt and it had Mama, Thanks, Tip Top, Huckleberry, and baseball player, I think it was. As nurses, we have to be certified, I think it's every other year, in a certain very detailed assessment called the NIH stroke scale. And it's for people who have suffered a stroke to kind of evaluate the level of damage from the stroke and to monitor progress of, progress after a stroke. So the verbal part of that assessment requires that patients repeat those exact certain words. So recently I was recertified in this, and to my recollection, in years past, you had to do it, it's an online assessment, and you had to do maybe one or two, maybe three patients where you had to do this assessment from start to finish. And to my recollection, as soon as you established a level of competency, the exam would end and you would get your certification. Well, a couple of weeks ago when I was doing this, I kept having to do patient after patient after patient after patient. And I thought, my gosh, am I failing this exam that I'm having to take so long to establish competency? But when I was done and the exam finally turned off, I got a near perfect score. So I was very relieved by that. It's an exam I've had to do probably 10 or 15 times in the course of being a nurse. So the topic I want to talk today is about implant selection. How often do you see where people feel very convicted that they have to have a certain brand or a certain model of implant for their joint replacement surgery? This is an area that I would leave solely into the hands of your well-chosen and experienced orthopedic surgeon. Implant manufacturers are very, very effective at marketing to you, the end user of their implants, to make you believe that you have to have a certain model in order for your surgery to be a success. And believe it or not, it won't surprise you to know that they want you to use their latest model and their most expensive model. So implants are chosen really on a contractual, that's a hard word for me, basis. And within those contracts, your surgeon has has all of the necessary latitude to use exactly the type and the size of implant that is appropriate for you. Your surgeon doesn't need your help in deciding what implant that you should receive. There is nothing wrong whatsoever in asking your surgeon and being curious about any aspect of your surgery, including this one. So ask all the questions you want, but take the burden of feeling like you need to help your surgeon decide what implant that you need off of your shoulders. One good example of this is there is an ACL sparing implant that can be used, and to the layperson or to many people, you might think, well, of course, if there's the option for me to keep my natural ACL, that is what we are going to do. Well, the fact of the matter is when you have really advanced arthritis within the knee, some of those insertion points can be compromised and that ACL ligament might not even be functioning anymore. So it's a moot point. The function of the ACL is built in with most implant models. There are models that allow for the sparing of an ACL, but the truth of it is those early models they proved not to really be as strong as the other ones. So those models have been improved in recent years, but it is an example of when you should just leave the implant selection up to your surgeon. I interacted with another lady who really was proud of the fact that she chose her surgeon and her hospital based on the fact that they use Zimmer implants. I love Zimmer implants. I think they're wonderful, but that's the wrong reason to choose your surgeon or your hospital. Have a good day, everyone.